Hi, this is Emma Wanzel with the Ethics and Society podcast, and we're with Dr. Faith Fletcher, Assistant Professor in the Department of Health Behavior at the University of Alabama at Birmingham. Hi, Faith.
Hi.
Thanks for doing this.
Thanks for having me, Emma.
So my first question that I'm going to ask you is, how did you first get started working in your field, or more specifically in ethics?
Okay. So my first encounter with bioethics was as an undergraduate student at Tuskegee University in 2001. I was one of the first students there to take part in the bioethics console. I also had the opportunity to take courses in bioethics and philosophy. So it was really there that I established my foundation for understanding the intersection between ethics and health inequities, especially as it impacts marginalized communities who are engaged in research studies.
So you talked about your educational background. So how did you get started specifically in your field at the intersection of public health and ethics?
Okay. Great question. So in 2013, I was a part of the Research Ethics Training Institute, and before then, I completed my PhD in health behavior and health education. I also completed postdoc studies in behavioral sciences and intervention development. So before that time, although I had distinct training in bioethics, interdisciplinary training in bioethics and public health, I encountered challenges finding the spaces and the language to really do this work. And some of my interest in public health ethics really emerged out of my dissertation study, which focused on HIV-positive women, pregnancy intentions, and stigma. And it was during that time that I encountered some ethical challenges in the field that really informed my interest in understanding more about research ethics related to protecting the rights and autonomy of research participants, but also the safety of research participants and the safety of research investigators as they engage in spaces where populations are marginalized and stigmatized.
Okay, so we talked about your educational background, your research. How did you get specifically to the population that you're working with today, and can you talk a little bit about that population? Okay.
So I actually first encountered an interest. My work is with African American women living with HIV, and I acquired an interest related to HIV/AIDS during my master's program in bioethics and humanities. It was during that time that I had the opportunity to travel to South Africa and understand more about breastfeeding disparities amongst women in Southern Africa. So I actually thought I would be this cool global health researcher who really studied disparities in sub-Saharan Africa, but during my time as a PhD student at the University of South Carolina, I saw that there were distinct disparities related to women living in the southern United States. So I shifted my focus, and I think my time in South Africa really exposed me to health disparities, structural disparities on a deeper level. But when it relates to African American women living with HIV, this population is disproportionately impacted by the HIV epidemic in the United States. So I felt passionate about working with this community, especially given the intersections of racial, gender, even geographic disparities that overlap and make this population especially susceptible to HIV, as well as negative health outcomes living with HIV.
So can you talk a little bit about what specific barriers that you see for this African American women, specifically in the South, in terms of HIV prevention and HIV treatment?
So very great question. Definitely I would say that HIV/AIDS related stigma on multiple levels. So when you think about socioecological perspectives on the individual level, the interpersonal level related to engaging with friends and family and in churches, and then there's these institutional and structural issues related to HIV access to care, access to prevention, access to other medications that extend and prolong life for HIV positive populations. So there are multiple barriers. As I mentioned, these barriers also intersect, so it makes it especially particularly challenging for women living with HIV, and some of the same barriers that heighten susceptibility are the same barriers that prevent HIV positive women from optimizing their health as a woman living with HIV. So my work currently, I'm working with researchers at the University of Alabama at Birmingham to understand more about HIV-related stigma, but HIV-related stigma within healthcare settings. So this is an area that definitely needs more exploration exploration. Some of my dissertation work suggested that women still encounter challenges and barriers related to negative interactions with healthcare staff within healthcare settings and healthcare providers. So there are opportunities for improving training within medical schools and residencies and even current physicians for reducing stigma and improving structural competency amongst healthcare providers.
Awesome. Okay, so kind of my last question, you talked a little bit about your current research working with medical professionals, and there's ample evidence of medical mistrust in the Black community for a very good reason. So I'm just wondering, like, what kind of ethical issues are you running into right now when you're working with these medical professionals?
Okay. So my work, I should have clarified, is more from the patient's perspectives, and again has implications. So I hope that in the future I can definitely be engaged in projects that address some of the healthcare incompetency and provider issues with HIV positive populations. But I can say I am also engaged in work with HIV positive populations and really interested in understanding some issues related to genomics research participation. So of course, the deep history of, you mentioned medical distrust, medical exploitation, especially in the southern United States with economically disadvantaged populations. So I'm really interested in understanding more at this point how potentially some of these factors historically might affect women's interest and barriers and perceptions related to participating in genomics, because there are huge opportunities for HIV positive populations and they're really being engaged and heavily recruited for genomics research studies. So it's at the intersection between public health and ethics that I'll be engaged in this work with this population. And again, to really understand, you mentioned medical distrust, but definitely from even an institutional level, we have to hold providers accountable. So I have a colleague who likes to say that medical providers and research investigators are not actually worthy of the trust of community. So really shifting that language and shifting the conversation so that we make the people in authority accountable for not respecting communities and communities' rights.
Okay, so I lied. I said that was the last question, but I really have one more. What advice do you have for young researchers who are really passionate about this subject and might not necessarily have the ethical background that you do?
So, excellent question. I feel like I was really fortunate to attend universities such as Tuskegee University and Michigan State, and I have wonderful ethics mentors. So I think there, again, are opportunities, especially for young investigators, to reach out to people, read the work of folks. I remember early on I would read books by ethicists and then send them emails or meet them at conferences. So, try to find opportunities to be in spaces with people in the field of bioethics. And there are also multiple programs. And again, there's the Research Ethics Training Institute, and I know it's, postgraduate training. But what I've learned is that it's both a challenge and an opportunity to essentially work towards establishing and carving out a niche in this area. And that's something that I've had to do, again, working in these two distinct fields that are definitely related, but with different funding challenges and different opportunities. So I highly recommend find someone who's doing the work that you're doing and as a graduate student, and really ask and engage them if they would be willing to support you in your career trajectory. That's what I've had to do. I've engaged people as a student at Tuskegee University and Michigan State University, and even becoming a part of the Research Training Institute. I still engage individuals such as Dr. Celia Fisher, who can help to mentor me and guide me to a place where I truly feel like I am an expert in the field of ethics as a public health ethicist.